I'm here with Dr. Carolyn Hewitt, who is a
General
GP.
practitioner, yeah.
And today we're going to talk about what a GP does
Yeah.
and why you would see a GP, how a GP could possibly help you as a person with a disability. So, should we start off with your work history?
So I trained at Flinders University, and that was 30 years ago. I actually trained with Dr Richard Harris, who was Australian of the Year and is famous for rescuing those beautiful boys in the cave. He's a diver and an anaesthetist.
Yeah, I think I've seen the ads for him on Flinders.
He's amazing. So that was 30 years ago, and I've been working as a general practitioner ever since, doing general medicine. So cradle to grave is what we call it. So we look after people from when they're born. We do baby checks, and vaccinate babies, and monitor people throughout their lives. We'll see teenagers and young people, women going through pregnancies. We see older people, and we help people eventually die in their own homes doing palliative care.
And that's what you're doing now?
That's what I'm doing now.
Okay, awesome. So then, as an example, when would I see a GP?
Knowing you, Pat, you're a young man, I suppose. You might have a bike accident. So you come and see me because you've got a laceration and I'd stitch you up. Or you might get tonsillitis. I'll prescribe some penicillin for you if you're not allergic to it.
So you can prescribe medication, I guess?
I prescribe medication and I do examinations. And I do vaccinations. People are travelling overseas. I work out a plan with somebody. I find out exactly what's important to that person, what their health goals are, and then come up with a plan to move forward. And then, because we're trained as scientists, we will then review you. Say we came up with a plan to help improve your nutrition. I would maybe do some blood tests and make sure that your B12 levels are good, your iron levels are good, your full blood count's good, things like that. And then I'd review you in, say, 6 months' time and make sure everything's travelling in the right direction.
And so then if you were to be working on my nutrition, you would refer me to someone else maybe if that wasn't your field?
I could. Absolutely. If I agreed with the way they did things. Great.
So you can connect people to other services?
Absolutely. So there are lots of people that I utilise their skills for. I feel that as a GP, I have a certain toolkit and I use the tools that I have in my toolkit, but I might not be, I'm not trained as a physiotherapist, say. And so say you fell off your bike and you hurt your shoulder. I would probably send you off to see a physio if I felt that that was the appropriate thing to do. And we would do several visits, which we can do, by the way, through a care plan as well. If it was a chronic problem that you had, we could use a care plan. And they use Medicare to then allow you to go and see an allied health professional. So that would be a physio, or it could be a speech therapist, or it could be a podiatrist, or it could be an exercise physiologist or a dietitian. I do care plans for things like we were just talking about, but I'll do mental health care plans.
So that's a separate topic.
If somebody, it's really good that you asked that question specifically because, it's interesting, isn't it, that they think of mental health as being separate to physical issues, but I suppose that's just the way they've worked it out. And so if somebody came to see me, say, with anxiety or depression or just feeling a little bit low, then we would talk about that. We'd first of all see if I could come up with a plan that was going to help them, if we already had a good rapport. So we'd come up with a plan, a basic plan like daily exercise, eating well, sleeping well, reduce screen time, checking out what your diurnal rhythm's like, making sure you're getting less screens at night time.
Yeah.
Maybe medication, maybe other things on the plan we might come up with. And then if that didn't work, then we could look at doing a mental health care plan and getting somebody in to see a psychologist. So a mental health care plan is something that Medicare allows us access to. We, first of all, I suppose, come up with the diagnosis as a GP. And then I would give you a measuring tool, which is either a K10 or a DAS. So that's a scoring system so that I can see exactly how severe you are at this point in time when we decide that you need your mental health care plan.
Yeah.
So it's just a piece of paper with some questions on it.
Yeah.
Saying things like, I get really worked up, or I find it really hard to wind down, or there's a whole heap of questions that ask specifically about depression and anxiety. And we'll go through that and we'll score you.
Yeah.
And that gives us a chance to then, once I've done the mental health care plan, which is just me talking through with you what sort of things might be appropriate for you.
So that could be a psychologist or a psychiatrist if you want, if you think the medication's necessary, or if the person wants medication. Yeah. Okay.
We usually start with a psychologist unless somebody's hearing voices or suffering from a delusional disorder whereby they think the TV's talking to them, or they think everybody at work's talking about them, paranoia, that sort of thing.
And you'll figure that out through the questions at the start. Okay. Yeah,
we
great.
always ask about that. And then once we've done that measuring tool and I do a mental health care plan, I then give the person the name of the psychologist and the number of the psychologist. Yeah. Sometimes I might even ring up and make the appointment, but often we're short on time and so we might not be able to.
Yeah. So you'll give the person seeking the mental health care plan a list of psychologists they could see in their area?
Yeah, absolutely.
Yeah, great.
Because, I suppose it's just like finding the GP that suits you. It's really important to find the right psychologist. And I can't know that just by me knowing the psychologist. It's such a personal thing. Yeah. It's a matter of who you gel with, who you can really relate to.
Definitely.
Yeah.
And those sessions that you refer for, does the person pay for them, or are they free in a mental health care plan?
So some psychologists, like some GPs, will bulk bill, which means that Medicare covers the whole of the cost. But some of them also actually charge a gap. So there might be a gap, and it might be anything from $10 gap up to $100 gap.
Yeah.
But there is a group called PsychMed, and they were always the bulk billing ones.
Okay. And people can find that online at PsychMed?
PsychMed.
Okay. Yeah.
The other thing that's important is that there are lots of actually really good mental health apps and online tools, and some people find that they're actually really useful. Yeah. Like specifically for YouTube, I'm using Melissa Tears at the moment as a really good, she does YouTubes and she talks about anxiety specifically. Yeah. Which everybody has at some point, and so I just refer people to that, and it's kind of like a really quick mental health hack. Yeah. Very quick information session, and a quick way of trying to stop the patterns.
What kind of evidence can a GP provide? Say, I know some people might be going for the disability support pension, some people might be trying to apply for NDIS, some people might need medical certificates for their mutual obligations. Yeah. Can you provide that kind of stuff?
Absolutely. So GPs are always writing reports for NDIS and for disability support plan. It doesn't necessarily mean you're going to get it, and it can be a really long process, but it's actually really good to do it with a GP because they can step you through the process as well and help you. There's a lot of GPs out there that are really skilled in helping with this sort of thing, and so I suppose it would be good to be able to find somebody that actually kind of follows you through and helps you. Yeah.
So then about finding a good GP, how would you find one that's going to be, you know, person-centered and that's going to help you through these things.
Yeah, if you don't already have one, because a lot of people have their family GP from when they were growing up, but if you don't already have one, I suppose you can just Google and find one in your area. And if you can't find one in your area, no, actually, you should be able to find one in your area.
So just go online, search
out.
GPs.
If you don't like the first one, that's, just see somebody else.
So you don't need to stick with the first one, you can change.
Yeah, you can change,
at your will.
Absolutely.
Yeah. How much does it cost to see a GP?
Some GPs will bulk bill, and you'll know that up front because some people actually advertise that they're bulk billing GPs, and I've noticed that there are more and more of them popping up. And so, try bulk billing one. Otherwise, when you ring up to make the appointment, just ask. Does the GP bulk bill? Yeah.
So if you find one that bulk bills, that means, if anyone doesn't know what bulk billing means, it means that you won't have to pay anything. That
That's
Medicare will cover
Medicare
the whole cost.
It, as long as you've got a Medicare card.
Yeah.
Up to date. Yeah.
That's all been really helpful. Thank you so much for talking with us today.
Yeah.
It was a pleasure. Hopefully people can find a GP like you that cares about their health.
Yeah. Thank you, Pat.
Thank you.
Yeah.